Hello, everyone. My name is Jierui Li. I was a graduate student at the University of Pennsylvania and received my master's degree in child psychology and statistics last year. The paper I will be presenting today is titled Exploring Telehealth ABA Therapy During the COVID-19 Pandemic for Children with Autism. First of all, I want to introduce some background knowledge. Autism spectrum disorder, ASD, is a neurological and developmental disorder with lifelong impairments in communication and the presence of repetitive and restricted behaviors. Research in this field has established that ABA, applied behavior analysis therapy, is an effective intervention for children with ASD, and this therapy is widely practiced throughout the United States. This therapy can help improve children's communication skills, increase their social cognitive skills, and reduces problem behaviors. Telehealth is a general term for the provision of telehealth care services through the use of technology. Telehealth aims to increase access to care by removing obstacles like transportation, geographic accessibility inequalities, or treatment delays. More importantly, the delivery of mental health interventions through telehealth has demonstrated to be cost and time effective. ABA therapy delivered through telehealth is one such. Even though telehealth ABA therapy has been recognized as a legitimate and efficient method of delivering ABA therapies, it wasn't until the COVID-19 pandemic that it was extensively used and researched. The current review summarized the research during the COVID-19 period on the application of telehealth ABA therapy to children with ASD. 3 telehealth ABA therapy models were identified in these studies during this period: the direct delivery model, the caregiver support model, the caregiver training model. Next, I will discuss the 3 models in detail. The direct telehealth model of ABA therapy refers to when a child participates in the virtual ABA sessions independently and receives the instructions delivered directly from an ABA service provider. 3 recent studies explored this direct telehealth model during the COVID-19 period. The teaching strategies used in these 3 studies include discrete trial training and natural environment teaching. The outcome of these 3 studies showed that telehealth ABA therapy enabled the kids to acquire and maintain their desired skills. The findings of all 3 studies combined showed the efficacy and efficiency of providing ABA therapy to children with ASD via a direct telehealth model. In the caregiver support telehealth model of ABA therapy, children with ASD will still receive the ABA training procedures directly from an ABA service provider. However, a caregiver will provide support for the procedures as needed in this model. There was one study incorporated the caregiver support model during the COVID-19 period. Caregivers of the children received training before the telehealth session started and were involved on minimal basis during the telehealth session. The result of the study showed that children in the caregiver support model also met the master criteria of the target skills and were able to maintain and generalize the skills in daily settings. The caregiver training telehealth models involves the ABA service provider provide trainings to the caregivers, and guiding the caregivers to implement the intervention. 2 studies during the COVID-19 period trained the caregiver virtually on implementing discrete trial training, natural environment teaching, and functional communication training. Their results show that the caregiver could implement the ABA procedures up to 95% accuracy, and children in these studies represented medium to large effect size improvements on their target skills and behavior goals. There were 2 other studies trained caregivers on early interventive behavioral intervention. Their results demonstrated that the caregivers effectively mastered on the target skills, but they didn't evaluate the potential outcome of the program on children's performance. During the COVID-19 period, some countries borrowed the models from the United States in ABA telehealth therapy in response to the disrupted ABA services due to lockdown. The study in Italy classified the children into 3 categories based on the children's need for support. The verbally interactive children received the therapy through the direct telehealth model. The minimally verbal children and the preschool children received ABA services through the caregiver training model. They found through daily virtual meetings that the program successfully brought order to these children's home activities. Similar to this, in the study of India, children received ABA therapy through different telehealth models based on children's capacity to attend the sessions independently. In their study, all children across the models acquired the target skills. This demonstrated that the telehealth ABA therapy could be culturally adaptive, and further proved the effectiveness of telehealth ABA therapy models. To conclude, this review summarized the studies during the COVID-19 period on telehealth ABA therapy for children with ASD. 9 studies were identified, and the 3 telehealth ABA models arose in these studies: the direct delivery model, the caregiver support model, and the caregiver training model. All of these 9 studies indicated that telehealth ABA therapy was effective and efficient during the COVID-19 period. This article also included 2 international models of ABA therapy during the COVID-19 period. These 2 international studies demonstrated that telehealth ABA therapy can be culturally adaptive, and further proved the effectiveness of telehealth ABA therapy. This study altogether also provides precious experiences in incorporating telehealth ABA therapy in the post-pandemic era. This alternative mode will be extremely helpful for children with ASD who live in areas with insufficient staff available or with limited transportation to ABA service provider. And that brings us to the end. Thank you so much for your interest and attention. If anyone would like to know more information or has questions, please feel free to email me. Thanks.